A heart attack is a life-changing event, and knowing what you can safely do after having one can feel overwhelming. But a new study claims not everything in your life has to change. In the U.S., someone has a heart attack every 40 seconds. And for those who survive, many avoid strenuous activities altogether for fear of triggering another one. But there's one activity that people tend to avoid that could actually be good for their hearts. A recent study tracked patients for 22 years following a heart attack. The study claims patients who maintained or increased their sexual activity within 6 months following a heart attack were 35% less likely to die over the 22-year span of the study. So, does this study finally provide the answer to the age-old question, is sex safe after a heart attack? My guest is urologist and author of the penis book, Dr. Aaron Spitz. Welcome to the show, Dr. Spitz.
Thank you. It's a pleasure to be here.
Absolutely. So do you believe there's truth to this study?
Yes, I do. This study takes the fear of having sex after a heart attack and puts it to bed. You know, this is not the first time that a study has demonstrated the positive health effects of sex. But the thing that's interesting about this study is that it showed that men who got back to sex sooner after a heart attack had longer lifespans, not just from heart disease, but from other causes, including cancer. So what's going on with these guys is very interesting. The study suggested that physical fitness, stronger spousal relationships, ability to cope with stress may have been contributing factors. I mean, we all know that it's important to eat right and exercise, but you might be surprised to know that a happy marriage can reduce the risk of mortality by almost 50%, which is twice as much as what we see with diet and exercise.
Sex can be stressful to the heart to some degree. I mean, you hear stories about people who, you know, were having intimate relationships and boom, they're gone, right? So the question is, how stressful is sex to the heart, and when is it too stressful to actually engage in sex?
You know, a lot of people have a misconception about how much physical stress sex puts on the heart. I mean, despite the gasping and sweating and contorting, the amount of exertion is actually only equal on average to walking up 2 flights of stairs. So if you can walk up 2 flights of stairs, you can have sex. For most men who suffer from a heart attack, sex is safe after about 2 weeks. For a very severe heart attack, it may be longer, but it's just a matter of checking with your cardiologist.
Are you finding patients who've had heart attacks, they're embarrassed to ask you about having sex after their condition?
Yes. You know, men are often embarrassed to talk about sex regardless, even with their doctor. And after a life-threatening condition like a heart attack, they may think that asking questions about sex is trivial, but it's not. Asking the doctor about sex is always fair game. And a lot of people will overestimate how long they have to refrain from sex, not only after a heart attack, but with other medical conditions or after surgical procedures. And they're often surprised how much sooner they really can get back to business. So I would tell every guy out there, don't be afraid to ask about sex, and don't be afraid to ask about medications for sex.
Sure.
The little blue pill and others like it can often be safely prescribed by doctors for men who need it.
Yeah, but the key is prescribed by doctors, not sharing with your friends and, you know, borrowing from someone else's medicine cabinet.
Absolutely right. I mean, there are certain medications, those that contain nitroglycerin, for which if you take these pills together, it can be lethal. So it's always important to have a prescription medicine prescribed to you by a doctor who understands what your health history is.